and welcome to Mature Allure, where we highlight the perspectives and experiences of women in midlife. Today we have Lauriann Greene with us. And Lauriann, why don't you go ahead and introduce yourself?
Sure. Thank you for having me again. I am definitely a woman in midlife. I'm 63, and I am starting my fourth business. But
Hmm.
this time, very different than what I've done before. I'm starting a coaching program, which is a combination of a course and course coaching people live on hair loss for women.
Hmm.
It's called Hair Loss Heroines because I think if you're losing your hair and you're working on it and doing something about it, then you are a heroine
Hmm.
because it's very difficult. And it's an 8-week course. And it's just getting started. I'm doing a beta test coming up in October, and then we will get started with the after I get feedback. We'll get started with the real course. So I help women struggling with hair loss, many of whom are in midlife or older,
Hmm.
and I help them to stop struggling, get out of the turmoil, have a roadmap for all the practical aspects of dealing with hair loss, and then find a brighter future where they can thrive in a new normal.
Well, as someone who is a healthcare coach and specializing in hair loss, what are some of the reasons women start to lose hair?
Oh, there are many reasons. It's one of the reasons that it's hard to diagnose. Um, uh, probably the most common form of hair loss is called, it used to be called female pattern baldness, but now it's called female pattern hair loss because it doesn't actually make you bald.
Yeah.
Only men or women with certain conditions actually get bald. Usually women get a diffuse kind of hair loss. Like I have. I mean, I have a very wide part. I have very little hair here. You can see it, my hairline is very thin. Um, but that's probably the most common thing, and that's caused by genetics. If your parents or grandparents lost hair, then it's probably in your genes, and that might happen to you. So there's two different kinds of hair loss, if I can simplify things. There's hair loss that does not damage the hair follicle, um, but hair can grow back because the follicle is still present. It doesn't always, but it can grow back. And then there is hair loss like I have. I have a scarring alopecia, which is an
Mhm.
autoimmune disease, and there are about 10 of these scarring alopecias, and the hair follicle is actually damaged and dies. So in those hair follicles, the hair can never grow again.
Okay.
So that's a basic um, overview of the two major kinds. But within that, there are maybe 20 kinds of hair loss that women deal with.
So how long have you been dealing with this kind of hair loss?
Unfortunately, my entire adult life, it started when I was 20. I lost about half my hair when I was 20. And I went to a dermatologist and started treatment, and I've had several actually quite famous dermatologists.
Mhm.
Uh, just because I've lived in major cities where these kinds of people are. And so I've had very good treatment. And my kind of scarring alopecia, and by the way, I should say alopecia the word alopecia just means hair loss.
Okay.
It's not a disease in itself or a condition in itself. It's just a medical term for hair loss. So, my kind, it actually, they say it burns out sometimes, meaning it goes into remission. So
Ah.
mine went into remission for about 13 years, and I didn't have to treat it anymore. And actually, during that time, I had hair transplants.
Hmm.
And usually women are not good candidates for hair transplants, but since I had a good amount of hair in the back of my head, because you need a donor site, it's a little gross to talk about, but they take it from the back and they put it in the front, basically.
Hmm.
So I had that done, and that's probably why I have as much hair as I do now. About 5 years ago, it came back. So I
Mm.
had to start treating it again. And I've had further shedding, and my hair has gotten thinner. Also, I'm older now. Like I said, I'm 63. So as you get older, hair loss is more common. And I should say that hair loss is a, a much more common occurrence among women of all ages than we think. We always think of men with hair loss,
Yeah.
but women, about 50% of all women will have hair loss at some point in their lives. There are even children who have hair loss. And then once you hit 65 or so, the rate goes up to 65%.
Wow.
Because aging plays a role.
Yeah, well, that's why I asked how long you had been dealing with it, because I know sometimes you want to associate it with as you're getting older, and yes, it does happen.
Hmm.
But just in case anyone's listening who may have a daughter, granddaughter, or maybe even younger, who could get something out of this and say, okay, well, it doesn't just happen in midlife. So that's really why, yeah,
I was just 20, and
yeah,
I know people younger who, and any kind of hair loss is abnormal.
yeah.
If it's going on for any period of time, I mean a month or more, it's not normal and should be looked into with a dermatologist.
Well, I was going to ask you, what is the difference between hair loss and hair shedding?
It's really it's semantics. It's two different ways of saying the same thing. I mean, uh, if you're losing your hair, you are shedding your hair.
Hmm.
So it's really the same thing. It's just that shedding sounds a little less, you know, less scary than
Okay.
hair loss
Well, then
does.
that brings up another question. What about hair thinning? Because you hear hair loss, hair shedding, and hair thinning. How does that?
I'm sorry.
How does it differ? Does hair thinning differ in that too?
It's again the same thing. As you lose your hair becomes more thin. So it's hair thinning, hair shedding, hair loss. It's just that the word loss is triggering for some people, so they say other things. It's all the same thing.
Well, part of what you do with hair loss heroines is helping women feel more confident during
Yes,
this. How do you do that? And especially like you said, the word between hair loss, hair shedding, hair thinning. I mean, all of those things can, like you said, it's semantics, but sometimes people feel better maybe saying my hair is thinning versus
sure.
I'm losing my hair. But how do you help women feel more confident during this time?
Well, you have to really work on your confidence because I can tell you from my own experience, losing your hair, whether it's thinning or shedding or whatever, if it gets to the point where you notice it, where, clumps of hair are coming out, or like I noticed it because I could see that my hair was thin. And I knew that wasn't normal. Um, and usually by the time you can notice that your hair is thin, you've lost at least half of your hair.
Oh, wow.
It takes that much to be able to see it with the naked eye.
Hmm.
So it was devastating. We think of our hair as women, there's all these messages we get from society. Your hair is your crowning glory. It's what makes you feminine. It's what makes you sexy and desirable. It's extremely. It's in the media, in every message you hear. It's uh, set up as so important to a woman's identity. So uh, I cried and cried. I didn't want to leave the house for weeks. It really it shakes you. It shakes your idea of yourself, your idea of yourself as a woman. And like you said, you just lose confidence in yourself, and you start obsessing about it. And it becomes that really all you think about is your hair loss. And that's when you look in the mirror, that's all you see.
Yeah.
You no longer see yourself. So there's a number of things that I do with women. First is I try to, excuse me, little allergies.
No
Um,
problem.
I give them a daily ritual to go through, which is meant to calm and center them. It's a combination of mindfulness. Some people call it meditation, gratitude, writing down the things that you're grateful for,
Mhm.
and affirmations. So, things, I am a strong woman.
Yeah.
I am much more than my hair. And visualizations can come with that, such as seeing, imagining light coming out of your hair, around you like a crown.
Mhm.
um, positive things. Then we work on all of the countering all of the things that we hear said either from the media or from other people. Uh, the media I just talked about. Other people who are not experiencing hair loss uh, can say things that are really not helpful. They are trying to be helpful in most cases, I think.
Mhm.
But for example, people might say to you, "Well, at least it's not cancer,"
Oh my
which
goodness.
of course is not an empathetic thing to say, because of course cancer is terrible and you wouldn't want to have cancer. I mean, of course I'd rather have hair loss than
Yeah.
cancer, but it's negating. It's not acknowledging that for you it's very, very, very upsetting and
Mhm.
very serious.
Mhm.
People will minimize it. They'll say, "Oh, I'm looking at you. It's really not that bad." You know, I
Yeah.
mean, to you, it's a catastrophe. Um, but
Exactly.
but to them it's not that bad, and you're not really at that point in a mood or a place to believe them. I mean, it may not be that bad, but saying that is not what you need when it's
Yeah.
first happening.
Yeah.
So and so not all families or partners or friends know how to be supportive during this time, because they're not familiar with this, and they kind of don't know what to do. So we talk about them. We talk about helping the people around you to understand what you're going through so you can be more confident. And probably the major thing I do is that we do exercises, and we talk a lot about that you are not your hair.
Mhm.
You are so much more than your hair. I asked them to write a list of 20 things about themselves that have nothing to do with their hair, but that they think are um, nice aspects of who they are. That they're strong, they're intelligent, they're talented, they're artistic. They have beautiful skin, they have
Hmm.
beautiful hands. They work out and they have a nice body. It just can go on and on. And so they realize that their hair is only one part of who they are. And it's compared to all the other things that they are, it starts to take on, with enough repetition, it takes on less importance as we go through the 8-week course. Repetition is very helpful. So the more you really, at first you might have to force yourself to say, well, I'm not my hair, but my hair is terrible.
Yeah.
And then the more you do it, you start to realize that you really, your hair is just a small part of who you are. So, and that's a real, that's the main way that people get their confidence back and that's not minimizing how difficult it is, but it
Hmm.
is a fact that you are many things and your hair is only one of them.
Yes. So let me ask you, how do you feel about products like Rogaine and Nutrafol? I think that's what it is, Nutrafol. How are they not an answer, but are they options?
I have to put them in two different categories.
Hmm.
Rogaine is minoxidil. That's the product. That's the drug. That's the medication that's in it.
Hmm.
And it's been around for about 50 years. It used to be a blood pressure medication until they realized that people who were using it started sprouting hair on their faces and their chest and their back, and they realized that it grew hair. So if you only put it on your scalp, it would grow hair only on your scalp. And it does work. It doesn't work for absolutely everyone, but it works for many, many people. It certainly helps keep the hair you have. And for some reason, for some people, it helps regrow your hair.
Mm.
So minoxidil is kind of the gold standard treatment. Uh,
Okay.
Most people who have hair loss are.
That scared me. It's an Amber Alert.
Oh, I see. Yeah, I get those on my
Yeah.
phone too.
And of all the times to do an emergency alert system testing. Oh,
Yeah,
wow.
you can't choose it. Uh,
Yeah, go ahead. I'm sorry.
yeah, it's the gold standard treatment. It's almost everybody uses it.
And
A
let me ask
Nutrafol.
real,
Yes,
let me ask
yes,
real quick before you go to the next one. Is it something you have to continue using? Like you can't really stop using it?
yes. Oh gosh.
You're getting
Uh,
it now.
that's all right.
Yeah, yeah, yeah,
It'll
that's fine.
stop.
Uh-huh.
Uh, so, yes, it is something, unfortunately, pretty much anything that you're going to use for your hair loss is going to be something that you're going to have to continue using.
Hmm.
Um, which is true of most medications. I mean, if you have atrial fibrillation in your heart, if you stop taking the medication for it, it's going to start up again.
Yeah.
So, medications generally have to be used consistently and long term. So, when you first start using Rogaine, there is some shedding that
Hmm.
happens, but it stops. And then yes, you have to apply it to your scalp. There's now they have done some studies and recently found that if you take it as a tablet, usually it's 1.5 or 2.5 milligrams, little white tablet, and you take it every day. That may work better than the foam or liquid that you apply topically. Now, I do both because I want to get the most bang for my buck, I guess. But, some people hate having to put it on every night. The Rogaine, it's usually 5% concentration, and you use it every night. So for those people, you can now take it by mouth. That's within the past 2 years, I'd say, that they've started doing that. So then you asked me about Nutrafol. There are many, 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 thousands of products out there that claim to grow hair. Nutrafol and another one called Viviscal have just enough proof that they've done clinical trials that they themselves have done, which makes them questionable because when you're
doing your
reviewing
own
your own
clinical
stuff,
trial.
of course, you're going to, say it works. So it's not objective. And they use a very small sample. They use like 42 people, which isn't enough to be able to say clinically this works to regrow hair. It's just enough that they have become very popular, and it's very expensive. It's about $90 for a month.
Oh, wow.
And some dermatologists actually sell it. There are dermatologists who are very interested in making money on products, and there are others that really don't care to do that because they don't feel that the product really works. My opinion, I'm not a doctor, I'm a medical researcher, but I know how to read clinical trials. And if you look on the TV commercials, there's all this fine print at the bottom that says, this is not cleared by the FDA, results may vary. In other words, it's not very reliable. So now that whole category of products, I put in the category of snake oil. Back in the 1800s, maybe before that, there were these traveling salesmen who had little vials of oil, and they would say, this can, cure tuberculosis and, give you better skin, and it'll make your hair regrow. And people would buy it from them and they'd put it on. And of course, it didn't do anything. It was probably olive oil or something like that. So those people became known as snake oil salesmen. And there are still many, many people who sell all kinds of oils and all kinds of products, and who will recommend, all kinds of vitamins and supplements and things like that. You should take collagen, things like that.
That was going to be my next question, the vitamins.
Yeah.
Right? Is that like a thing, or?
It's only a thing if, when you go to a dermatologist, the dermatologist will do blood tests, and they'll do them probably yearly. And they're looking for deficiencies in certain vitamins. Like they'll always check for iron and zinc and vitamin D. And I think they check for biotin. And if they find that you have a deficiency, that your levels are too low, then they will prescribe a certain amount for you to start taking to get those levels back up to normal levels. If you don't have a deficiency, there is no reason to take anything other than, like, I take a multivitamin every day just because, if there's any little deficiencies or something. It's also for older people. It's supposed to help prevent Alzheimer's disease. So I just take a multivitamin, and that's meant for women over 50. But taking biotin, for example, everybody talks about that for skin and hair and nails. We get plenty of biotin in, if you have a normal diet, not even a great diet, just a normal diet, you're getting plenty of biotin. So you don't need to supplement that. And
Mhm.
collagen, it's not like if you take collagen, it goes directly to your hair. It gets metabolized in
Mhm.
your digestive system, and a little bit, it's kind of protein, and a little bit goes all over the place. And there's nothing that has shown that it particularly helps hair or skin
Mhm.
or nails.
Mhm.
So, yeah, so the only reason you really need to depend on the dermatologist. You know, the dermatologist knows a lot more than I do, a lot more than any of us do, unless we have medical degrees. And they know when you need something. And you know, if collagen regrew hair, every dermatologist would recommend it. The reason that no dermatologist I've ever been to or I've ever read anything from recommends collagen is because it doesn't work.
Yeah.
You know, and if any of these, like, there's all these shampoos that say that, you know, they help regrow hair. Some of them have a little minoxidil, a little Rogaine in them.
Mhm.
However, Rogaine has to sit on your scalp for a good amount of time. Like, I use it at night, so it's
Mhm.
at least 8 hours that it's sitting on my scalp. When you wash your hair for a few minutes, and then you rinse it out.
Yeah.
So it's not on your head long enough to do anything. And if it
Mm.
really regrew hair, since it's then running all over your body, you'd have hair growing on your body.
Everywhere.
Because that's why with Rogaine, they tell you after you put it on your hair, you have to wash your hands very thoroughly so you don't touch your face or other places because you can get hair starting to grow there.
Oh,
So,
wow.
yeah, so you don't want a shampoo with Rogaine going all over your body because who knows what's going to happen. So, there's a lot of myths out there about hair loss. There are a lot of false claims, and you know the supplement and beauty industries are totally unregulated.
Mhm.
Uh, it's not like the FDA with food. There's nothing that regulates them. Like people say take saw palmetto or ashwagandha. And you can buy 3 bottles of saw palmetto, and there will be 3 different amounts of saw
Mm.
palmetto in there, if there's any.
Yeah.
Uh, Sometimes it's just going to be some sort of powder because there's nothing to regulate it. So you don't know what you're getting. And some of
Mm.
these things, just because something's natural, doesn't mean that it's better for you than medication. Natural things can interfere with medications that you're taking. They can also, you can have allergic reactions to them, and they can cause side effects. They can cause gastritis, you know, stomach problems,
Mhm.
diarrhea, um, you know, other kinds of side effects. So, natural does not equal better than medication. Everything that you put in your mouth or that you put on your skin can have side effects.
Yeah.
Just to
Yeah.
be clear about that.
So then let me ask you, because you mentioned earlier about the hair transplants in women.
Yeah.
Like, have they changed over the years? Like, are they better than they used to be?
Oh, yeah.
What is it about them that maybe they weren't working so well for women?
Well, the problem that the reason most women are not good candidates is that they tend to have this thinning all over, including the
Mm.
donor area, which is back here.
Mm-hmm.
For some reason, my hair loss has not affected the donor area.
Okay.
I usually, because had a scarring alopecia, um, I wouldn't have been a good candidate. But because it was in remission and I went to, I was living in Paris at the time, and I went to a man who was a pioneer
Mm.
in creating the hair transplant techniques. He felt that he could do it and it would be successful with me, and it was successful
Wow.
for 13 years. I had almost maybe a quarter less than what I had when I was a kid. And you
Wow.
couldn't tell by looking at me that I had thin hair. Um,
So then
so
when you what just asking to piggyback off of that, when you said when you were in remission, you were able to have this done. Once you went out of remission,
no,
the transplants don't work?
no,
Okay.
because then you'd be um, the scalp is so full of inflammation that it would
Mm.
attack those new follicles and it would
Mm.
kill them.
Okay.
So Uh, now, what comes from the back of your head, the reason they use that is that men who get hair loss and they're all bald here, but they have like a ring of hair
Yeah.
around. The
Yeah.
hair that's around the bottom is naturally more resistant to the things that cause hair loss. So
Uh,
those probably the reason that I have as much hair as I do is because I have those, and they were in my head long enough to be really well
needed.
anchored.
Okay.
So they're no longer, the inflammation doesn't bother them. But if you do it while the inflammation is going on, it's probably not going to take.
Mhm.
So the techniques are much better. They do actually hair by hair transplantation. They take, it sounds gross, but they take a strip of scalp out
Mhm.
of the back. And then they have a technician who microscopically cuts it into individual hairs, or sometimes there's two hairs. And then it really sounds gross. They make a bunch of holes in the
Uh-huh.
places that they want to put it, and then they take under a microscope, they take the follicle and they stick it in the hole.
Mm.
And it's like a plant, and it eventually attaches to the blood supply, and it starts to grow.
Wow.
So it gives you hair in places where it was really thin, and you don't miss it back here if you have enough hair.
Mhm.
And they sew the incision very closely, so it becomes a very thin line scar. It's not like there's a
Mm.
piece where you're missing hair back here. If I were
Yeah.
to put my
Yeah.
hair up, you wouldn't notice it. So, so
Yeah.
it's because it's so hair by hair. Uh, Nobody has ever said to me that they would imagine that I've had hair transplants, even
Wow.
hairstylists. It's impossible to tell.
So
So,
how long did it take, the process?
the process itself took about 2 hours, I'd say, and they
Okay.
put you. It's not anesthesia, but they put you in what they call a twilight state,
Mhm.
where you're kind of not really aware of what's going on.
Mhm.
And then you rest for about an hour, and then you have to wear a very tight tourniquet
Mhm.
because, again, to make sure everything stays put and doesn't move and doesn't, when you're rubbing against something.
Yeah.
And then actually, the hairs that were in the follicles that were transplanted fall out because it's a
Mm.
shock to the scalp, that you've put in you've made all
Yeah.
these incisions. So but they within about 3 or 4 months they start regrowing, and then in 6 to 12 months they grow to a length where you start to see thicker hair. So it's a
Mm.
process. But
Mhm.
by when it worked, boy, I was happy. But
It was a sense of relief.
unfortunately, it,
Yeah.
it was fantastic. I mean, people said to me, "Wow, your hair looks great," but
Well,
it's not for everybody.
yeah.
It's has to be particularly good situation for a woman. Usually, they say women are not good candidates for hair transplants. I was an exception, I guess.
Mm-hmm.
So there you go about hair transplants. It's one of the things that is, a tool that you
Yeah,
can use, and that for some women may be possible. Something to at least ask about.
exactly. So you mentioned going to a dermatologist. If
Yes.
somebody is suffering from hair loss or shedding, however they see it, and they go to a dermatologist, what are some questions that you would suggest they ask to kind of get the right answers?
Well, usually it's the dermatologist who's going to start out asking lots of questions. They're going to
Mm-hmm.
ask them all about their lifestyle. How long have they noticed the shedding? Do they have any other symptoms? Do they have they had any, anything in particular happen in their lives recently in the past 6 months? For example, some sort of shock, like a death, or losing your job, or some sort of car accident, some sort of very traumatic event which causes a tremendous amount of stress, because stress is a very, very big contributor to hair loss. If they've lost 20 pounds or more, that can also cause hair loss. They'll ask them if they have any other medical conditions, because some of those can cause hair loss, and they'll ask all the medications you take, because some of those can cause hair loss. So they're
Mm-hmm.
going to ask you a battery of questions. Um, and then they're going to start examining you. They will examine your scalp, very, very. They'll take a little, looks like a jeweler's loop, but
Mm-hmm.
it's like a little handheld microscope, and they'll put it right on your scalp so they can see the follicles up close. They'll see, what else is happening on the scalp. Are there, sometimes you get pimples, sometimes there's the redness of the inflammation that you can see with the naked eye. They will pull on your hair, and
Mm-hmm.
if the hair comes out as they're pulling on it, like I just pulled on my hair and nothing came out.
Yeah.
If the hair comes out, that tells them something.
Mm-hmm.
They may do what's called a punch biopsy, if they suspect that it might be one of the diseases of the scalp. The only way to tell is to have a little piece of scalp, and to look at it under the microscope, and to study it, and they know
Mm-hmm.
what to look for to see what kind of disease it might be. And
Mm-hmm.
they call it a punch because it's the size of a pencil, but it's hollow. So they just go
Ah,
poop like that, and it takes a
ah,
little teeny round sample, and they take one stitch, and you're done with it. And they do it in the back,
yeah.
so it's not noticeable, and the stitch closes it
Okay.
up anyway. That's pretty standard. They're going to order all kinds of blood tests,
Mm-hmm.
and then they'll get the blood tests back. Um, the the things to ask after you've let the doctor do her or his thing,
Mm-hmm.
um, is because they have a protocol, and they know what they're doing.
Mm-hmm.
Um, the things to ask are, uh, can you tell anything just from what you've seen so far? They may say, I need the results of the biopsy, or I need the results of the blood test first. Or they may say, it looks like this
Yeah.
particular thing, but I need the other results to confirm it.
Okay.
You can ask them, really, you asking questions really comes after you have a diagnosis.
Okay.
So once you have a diagnosis, then the question is, what is your treatment plan? What are you
Mm,
planning on giving me? Uh, do I have the kind of condition where, um, all hair loss is progressive if you do nothing about it.
okay.
So you don't have to ask, is it going to progress? Uh, they're going to say to you, oh, I'm going to give you something to try to help it not progress.
Uh-huh.
And you can ask, do I have a chance of regrowing my hair?
Mhm. Mhm.
And they'll say yes or no, or they'll say, well, I'm going to give you this medication, which sometimes helps regrow hair.
Mhm.
So you need to know what the treatment plan is. You can ask, how long will it be before I start seeing results? And it's usually, you need to be patient. It's usually 3 to 12 months before
Wow.
you start seeing results of any kind of treatment.
Mhm.
Um, so, what else can you ask? You can ask, do I need this medication you're giving me? You should always ask, exactly how to take it and write it down so you're sure.
Mhm.
And will I be taking this for the rest of my life? Um, that's a question to ask. Will taking it make my hair shed at first? That's another question you can ask. I actually have a little um, uh, I call it a bonus that's part of the program, that is a checklist
Mhm.
of things that the first time you go to the doctor, that you should be looking for, and questions you should be asking. And before you leave, make sure these you're sure of these 5 things.
Mhm.
So it's a checklist for your dermatologist appointment.
Okay.
So it's a good question you asked. What kind of questions should we ask the dermatologist?
Yeah. So what I know that a lot of times hair thinning, shedding, loss can happen in menopause.
Yes.
What are the reasonings behind that? If you can just give us a
Any kind of big hormonal shift
Mhm.
qualifies as one of those sort of traumatic or sudden things, like losing 20 pounds, that can cause hair loss.
Mhm.
It's a major shift in your hormonal system, just as pregnancy is. Many women lose hair during and after pregnancy. Now, it
Mhm.
almost always grows back. That's with pregnancy. With
Mhm.
menopause, it may not grow back,
Mhm.
because estrogen helps to block another kind of hormone, which is the male hormone, which is DHT,
Mhm.
dihydrotestosterone.
Mhm.
It's a mouthful. We all have testosterone. Women have it, men have it.
Mhm.
But estrogen keeps it from turning into DHT, which has the effect of making your hair fall out.
Wow.
So that's why there's a medication called Propecia, and that's a DHT blocker. So it's mostly given to men because in women of childbearing age, it causes birth defects. But with older women, women who are well past menopause, they may give that to you as well. So really, there are only maybe about 8 or 9 real treatments that have been proven to help either stop the progression of hair loss or help you regrow hair. It's a
Mhm.
very small number because hair loss is very, very complex. They are still they still don't completely understand. When I say they, I mean the medical community and researchers. They don't completely understand why people lose their hair. The mechanism of the follicle and the papilla, which is what connects the follicle to the blood supply under the skin, um, is extremely complex. You know, they don't understand like what it is in the brain that sends the signal to the follicle to make it work. I mean, the follicle even has muscle tissue around it, and that's
Wow.
why when you have the goosebumps, your hair stands on end because there's a
Ah.
muscle that makes the hair go like this.
Oh,
So,
wow.
yeah, it's a very complex mechanism. And
Mhm.
so they've been able to find up to this point very, very few things that actually have an effect on it. Um, and that's why we also, you know, part of the program is talking about hair care, because the way you take care of your hair can either, some of it can make you lose your hair, like
Mhm.
people who get their hair relaxed and colored on the same day. It's
Mhm.
too much processing. It sort of scalds the scalp,
Mhm.
and the ingredients are too harsh. Or people who use hot tools and they get too
Yeah.
close to the, like a curling iron, they get too close to the scalp, or they're constantly pulling at their hair, or they're wearing their hair in a very tight style, like, you know, ballet dancers who always
Mhm.
have, you know, this very tight bun at the top of their head. The
Yeah.
constant pulling can actually pull your follicles out and damage the follicles.
And that's a good point because there are a lot of people who wear braids and they're very, very tight, and you can see that the follicles have come out. Is there any way that the follicles will come back, or?
Once, if it's been long enough and you've been pulling in a certain place long enough, you get what's called traction
Uh-huh.
alopecia. And that is permanent because you have
Mm.
damaged the hair follicles.
Mm.
And you will have, you know, spots wherever, you know, like wherever the braid was attached, you'll have spots that are bald. So the
Mhm.
key is to not wear braids all the time. Wear it for a
Yeah.
while, then you take a rest. You know, you do something else with your hair. Let it be natural. I mean,
Mhm.
I'm all for natural hair. I mean, my hair is very curly, and you know,
Mhm.
I let it do its thing.
Yeah.
So the more natural you can go, the less you're manipulating your hair. So we do talk about hair care using very mild products. This old myth about, you know, the women who have long hair, you know, you have to do 100 strokes every night to keep it healthy. I mean, you're like pulling on your hair 100 times every night. I mean, you're gonna
Brush it
cause hair
out.
loss. Yeah,
Brush it right
exactly.
off your
So,
hair.
so we talk about that, and we also talk about what they call alternative hair, which is, first of all, there's camouflage. There are products like root products that you
Mhm.
can put on the bald spots. I use that sometimes,
Mhm.
and it'll cover up the bald spots and make your hair look thicker. Um,
Mhm.
and then there are toppers, which is what they used to call a wiglet. It's a
Uh,
small wig. It doesn't have a cap. It
uh-huh.
attaches by clips. So
Mhm.
I have one of those that I wear sometimes, and if
Mhm.
I'm feeling a little self-conscious,
Uh-huh.
or it's a special occasion, and it just covers the top, which is where I have the most hair loss.
Mhm.
Um, and then there are wigs, and we have a wig expert who herself wears wigs every day because she has very little hair left. And she is a guest speaker for one of the weeks of the program, and she will. We have a whole list of things that she will talk about getting to understand how wigs work, because it isn't as simple as it seems.
No,
And
it's
then she'll
not.
take lots of questions. But there's lots of paraphernalia to do with wigs.
There
And
is.
there's and you have to know how to measure your head and get the right size, and there's different
Yeah.
kinds of construction, and
Yeah,
it's
I've never been a wig girl myself, but when I've
yeah,
tried, there's a whole lot going on with it. They're just
yeah,
too hot for me. For
yeah.
it's too hot.
Well,
Too
they have made them in recent years in a way that, first of all, there's a lot of air going through it.
there.
It's not like a solid cap, like a swimming cap.
Hmm.
So it's not quite as hot. And The other thing is that they now have what's called a lace front. So when you
Hmm.
first get it's all lace, and then you cut it to be very close to your hairline, and it lays down, and it
Hmm.
looks like the hair is coming out of your scalp. It's
Hmm.
almost undetectable. This is
Hmm.
not your mom's wig where
No, no.
it was really obvious, and there are ways of even a gale force wind, it's not going to come off your
Yeah.
head.
Uh-huh.
So that industry has really, really improved a lot.
Yeah.
And some women, for their confidence, we do exercises. Look at yourself in the mirror, find, write down, have a pad next to the mirror, write down 5 nice things that you see about yourself. I have beautiful eyes, I have nice skin, I have
Hmm.
lovely lips, to get them to be able to look in the mirror again, because a lot of women can't look in the mirror anymore. For some women to really feel whole again and not
Wow.
self-conscious, they need to wear a topper or a wig, and it
Hmm.
makes a huge difference.
Yeah.
They feel like, oh, I'm back to being myself again.
Yeah.
So, we definitely want to include that, and it's a very, very valid thing. And some women shave their heads and then wear wigs every day. So
Wow.
that's perfectly fine.
Hmm.
Whatever works for you, that's another thing, is that, nobody can tell you how to feel
Yeah.
about this. You feel what you feel, and you do what you need to do to make yourself feel good.
Yeah.
Those are the big messages, because acceptance and, feeling good about yourself. A lot of people get depressed
Yeah.
and lose their self-esteem. And of course, we don't want that. So we want
Yeah.
to build them up and make them realize that this is something, if they have to live with it, it is something you can live with. There are things you can do about it. And you don't have to be ashamed. You don't have to be embarrassed. You don't have to take the crap that other people are saying to you if it's really not helpful. You know,
Yeah.
you're your own person, and you do you, you know.
Well, Lauriann, this has been a wonderful and enlightening conversation. I
Oh, I'm
thank you so
glad.
much. Thank you so
That's
much
my
for being
pleasure.
here. Yeah, if somebody wants to get in touch with you, find out more about Hair Loss Heroines, how can they go about doing that?
Well, there's several ways. First of all, they can send me an email. It's very simple: hairlossheroines at gmail.com. Or
Hmm.
they can go to my website, which is hairlossheroines.com. Or they can go to our Facebook group, which is facebook.com/hairlossheroines.
Okay.
So all of those work. And just remember, heroin is OI, not IO. That's the thing that people mix up. Even I do that when I type
Yeah,
it.
and
So
it's with an S, and it's with an S, right? Not Hair Loss
yes,
Heroine.
heroines, plural.
Yes.
Yes,
with an S.
because it's for everybody
Mm-hmm.
who does this. And
Mm-hmm.
I consider that, anybody who's willing to face this very difficult challenge in their life is a heroine, because it's tough.
Absolutely.
It's really tough, in many, many, many ways.
Yeah,
And to have the strength to really face it is heroic. It means you're a really
absolutely.
strong woman.
Absolutely. Well, thank you, Lauriann, for being a guest here on Mature Allure.
Thank you so
And
much. It was a pleasure.
it really was. And I will talk to you later.
All right. Take care.
You're listening to the Mature Allure podcast. I'm your host, Sherri O. If you have a topic in mind that you'd like us to cover on Mature Allure, drop us a note in the comments or share it with us on one of our social media channels. Until the next time, remember, self-love is the key to unlocking the radiant allure that shines from within.